All right, MED200, we'll do our review on the reproductive system. All right, so matching some terms. So A through G, vasectomy. So the only term that would work would be the vas deferens, right? So D. Mixture of sperm and fluid. What do we call that mixture? That would be the full ejaculate. That would be the semen. So we finished D. Finish F. Sperm cell formation. What's the term for sperm cell formation? So here we have genesis, generating of sperm. So that'll help you. Spermatogenesis. Yep. Secretes alkaline fluid and prostaglandins. So, yep, seminal vesicle. So it's either the seminal vesicle or the prostate that did that. Produces testosterone. And this testes, more specifically the interstitial cells, if they ask for that. Well, here, testes fine. Gonadotropic releasing hormone. Where does that come from? So that's produced in the and released in the hypothalamus. So that triggers puberty. And lastly, erectile tissue. That's in the penis. All right, so not too bad. Some of the terms from the reproductive system. More common in men over 40 years old. So these are very similar in definition. Benign prostatic hypertrophy, epididymis, prostate cancer, testicular cancer. So men over 40. So yeah, very good. Prostate cancer. Older men causing difficulties urinating. So the prostate is wrapped around the urethra. So usually if the prostate gets swollen, it's going to pinch off the urethra, causing urination difficulties. More common in males 15 to 30 years old and is aggressive. So of the last two, which one is more aggressive? Definitely cancer. And then lastly, often starts as a UTI, and then if it goes up the vas deferens, it might cause this structure to become infected, so the epididymis. So very similar. Male disorders. True or false? The ovaries only produce estrogen. True or false? Only estrogen. False. It also produces male hormones, remember? Progesterone. So you cycle through estrogen and progesterone. Female body, the ovaries will produce both. Ovulation is the process of ovum formation. Is that making the egg or releasing the egg? So,
no, I'm sorry.
Which one's making? So this is making the egg. Ovulation is just releasing the egg, right? So oogenesis is production of the egg. The fallopian tube is also called the oviduct. Yeah, that's another name for it. So uterine tube, uterine salpingo, those are all synonymous for fallopian tube. Endometrium is the outermost layer. True or false? Where is endo? Is that inside or outside? So this would be false, right? Endo is inner layer. Alveolar glands produce milk. What produces milk? Milk glands, right? So milk glands produce milk. Yeah, alveolar. Oxytocin induces the alveolar glands to deliver milk through the nipples. Does that cause milk release? Oxytocin. Lactoferous ducts. So, lact. Menarche. Is that the end of the menstrual cycle? Termination. Isn't that menopause? So menarche is the first. That's the first. Menopause occurs due to normal aging of the ovaries. Not too bad. Couple more. Inflammation of the cervix. Easy enough. Inflammation of the cervix. Cancer common in post-menopausal women. B, cervical cancer? G, uterine cancer? Yeah. Yeah, uterine cancer. So they call that endometrial cancer. Develops slowly, detected by pap smear. Pap smear. That's going to detect that they dilate you, scrape some tissue. That's the pap smear. So they'll dilate, they'll scrape some cells off the cervix, and they'll look at it. Uterine tissue grows outside of the uterus. So the inner layer is called the endometrium. So that's endometriosis. Second leading cause of cancer death in women. Oh, this gave it away. So this one's going to be D, right? So make sure you're doing your self-examination. Severe menstrual cramps. This is difficulty, painful, or abnormal. And then lastly, benign tumors of the uterine wall. Those are fibroids. They look like fibroids. Not too bad. What are the primary germ layers and what tissues develop from them? So when the egg, the zygote, is dividing quickly, right? It then splits into 3 layers. So what are those layers called? Inside. So that's going to be the endo for the inside. Middle layer, the term for middle is mesoderm. And then the outside is the ectoderm. So those are the 3 layers. So it's just the inner layer, the middle layer, and the outer layer. And whatever develops from them, right? So ectoderm, tissue, some of your skin. Mesoderm, that's bone, some of your skin. And then the endoderm becomes skin only. What are the 3 stages of the birth process? What's the first thing that has to happen? Dilation, very good. And then the next thing that happens? The baby comes out, right? So they call that expulsion. And then what's the next thing that comes out? There you go. So they call it the dilation process, the expulsion, and then sometimes they call it the afterbirth, but that's called the placental stage. About 30 minutes after the baby, usually the placenta will come out. And you guys ever heard of cord blood? Storing the cord blood? Because there's stem cells in the cord blood. So if you have any genetic disorders, that stem cell might help. No. Infuse it. So they'll withdraw the blood from the placenta. They'll save the stem cells. And if you have something like leukemia, they can infuse that into you and hopefully regrow all your blood cells. So stem cell therapy.
I know people that ate the placenta after they had their babies.
So that's a tradition in some cultures.
Like animals do it, and I know they do it because it's good for the milk for the babies or something.
But why do humans do it? Why do they eat the placenta? It's just tradition.
She did it with her kids, but she cooked it and then she ate it.
Yeah. So there's some tradition, and there's some like placebo effects from that. Pretty interesting. I'll try anything once.
She ate it.
Pregnant. I can't get pregnant. I'm using the rhythm method. So what would you tell that patient? Pregnant? I can't be pregnant.
Well, there's no such a thing as a birth control method that is 100%.
But why isn't the rhythm method 100%? Because what is this thing trying to predict? It's trying to predict ovulation, right? And is ovulation very predictable?
Yeah.
Not too much. So that's the main thing. Rhythm method is good, but ovulation is random. So even though your timing is good, your body may not. So it's hard to tell when you actually ovulate. Male, female, or both. Retrograde ejaculation. You had an orgasm and then you ejaculate later. Is that male or female problems? Or both?
I don't know if they named the same thing, but I'm gonna say both.
Both? Women? Ladies? Yeah? Do you have delayed?
I forgot the name of that thing.
Male.
What?
Yeah, it's only a problem with male. Women, for infertility, it doesn't matter if you orgasm or not, or ejaculate or not, right? Doesn't matter. Mumps infection can cause infertility in males, female, or both. So remember the high fever that may accompany mumps and measles will pretty much kill off all the stem cells in the testes. So it's a leading cause of infertility. Inadequate diet. Male, female, or both? So it's more going to be the ladies. So ladies, no sushi for you. No mercury. So if you're of childbearing age, you should stay away from all that fancy diet stuff. Scarring from STIs. Scarring of the reproductive tract. Male, female, or both? Most likely in the... They say both. So I guess if the sperm can't get out or the sperm can't get in, you're not going to get pregnant, right? Pelvic inflammatory disease. Usually only affects who? Male, female, or both?
Female.
Usually only female. Hormone imbalances. So either you don't ovulate or the uterine conditions aren't available for implantation. Use of medication.
Both.
They say male? I'd say both as well. All right, we'll go with the publishers. Being over 40 years old.
Female.
Yeah, so menopause. So in general, male, female, or both. Most common reported sexually transmitted infection. Herpes, not most reported. It's gonna be, yeah. Stay away. Stay away from Oceanside. There's a big military base there. Two types, both caused by a virus. So we have simplex 1 and simplex 2. Simplex 1 is oral cavity, simplex 2 is the genital area. But they don't care. They'll affect any skin, any tissue. Crabs, it's another name for crabs. Pubic lice, yeah. Pubic lice.
Didn't see that.
Increased incidence in males. Syphilis, warts, or gonorrhea? Huh. I guess syphilis.
Yeah.
So that can turn you sterile and insane. You can get dementia for syphilis.
What?
Yeah. Common bacterial infection can also grow in the mouth. So what causes warts? Viruses. Ooh, gonorrhea.
Right.
And then virus HPV, that causes the papules. Not fun at all. All right. Now there is a flesh-eating sexually transmitted infection. So you can catch something that will literally eat your flesh off. So there's a flesh-eating one. What's that?
Is that in Florida?
I don't know.
They have the flesh-eating bacteria in the ocean.
Oh yeah, but this is sexually transmitted. So now not only will you get an infection that might turn you crazy and sterile, but you can now have flesh. And a lot of these infections are now resistant to antibiotics. So once you get the infection, it's harder and harder to treat. So let's go ahead and go on to week 2, day 1. Your access code is the number 22. MED200, homework week 2, day 1. So this is mostly going to be the reproductive system. All right, testosterone is produced in the blank of the testes. Yep, very good. The interstitial cells. So sperm is made here. Epididymis is where they're stored. This is the tubing, and this is the pre-ejaculate. Number 2, the innermost layer of the uterus is the endometrium. Very good. This is the muscle layer. Peri is the outer layer around. Infundium, that's on the fallopian tubes, the end of the fallopian tubes. Number 3, in blank, the normal uterine lining is found outside of the uterus. Yep, endometriosis. So if this is outside of the inner layer of the uterus, then it is a problem. 4, newborn is considered a neonate. Up to what age? 4 weeks, very good. The first month or so. Newborn, 6 weeks. So that's why they have the 6 weeks here. Neonate, only 4 weeks. After 4 weeks, infant, up to a year. The patch is a blank method of contraception. Yep, through the skin. It doesn't block sperm. It doesn't block sperm. It doesn't kill sperm. Yep, transdermal. 6. An enlargement of the prostate gland due to normal hormonal changes as a man ages is known as benign prostatic hypertrophy. Very good. This is inflammation of the epididymis. This is inflammation of the prostate. So BPH, the only one that fits. Number 7. The union of the nucleus of an ovum and the nucleus of a sperm to create one nucleus containing 46 chromosomes results in a what? Zygote. Yep, zygote. Blastopore is a little bit further along when the ball of cells starts to hollow out. Embryo, that's when you start seeing the structures, fingers and toes, tails and gills. 8. Which of the following is not a test performed to diagnose infertility? Yeah, amniocentesis, the woman is already pregnant. This is when they puncture through the abdominal wall into the uterus and get out some of that fluid. So, already pregnant. Semen analysis, sperm count, endometrium biopsy, see if there's any problems. This is the tube, salpingo. So that's the uterine tube. Number 9. The most common STI in the US is chlamydia. And we know about the dangers of that flesh-eating infection now. And a lot of these are drug resistant. So it'll be harder to fight off. 10. The structure in a fetus that allows most of the blood to bypass the liver is the venosus. Very good. Foramen ovale, that's the hole in the heart. All right. Last few are the tracings. They should be reviewed, right? Getting little smiles. So yeah, we got this last week and again on your quiz, I believe. So we'll start with the vena cava, blood through the heart. Vena cava, we are on the right side of the heart. The top chamber is called the atrium. On the right side, we have which valve? I will try to get it right, which lead us to the right ventricle. Where are you? There you are. All right, now to prevent backflow, there is a valve. So we're going to the lungs next. So yes, the pulmonary semilunar valve. Going away from the heart. Which blood vessel sends blood away from the heart? Away from the heart. Arteries or veins? Arteries. So this is going to be the pulmonary artery. There you are, up there. And then we go to the lungs, picking up oxygen. Vessels going back to the heart are called veins. So we have pulmonary veins. Has nothing to do with oxygenation, only direction of blood flow. All right, what chamber are we in now? The upper left chamber is the left atrium. Try to get it right. So on the left side, we'll have the bicuspis. What's the other name for bicuspis? Starts with an M. Mitral valve. So that's the other name for it. Then we're in the lower chamber, left ventricle. To prevent backflow into the left ventricle, we have another valve. This time it is the aortic semilunar valve, and the largest artery in your body is the aorta. So not too bad. The tracing, you had it a couple times before. Hopefully the repetition will help you remember it. All right, now let's trace the path of oxygen through the respiratory tract. So from the outside world to the capillary beds, and the epiglottis should be in the open position. Right? So let's see. So through the nostrils, into the nasal cavity, which has the nasal concha. That increases surface area for heating and humidifying the air. Next, we have the back of the nose, which is the nasal pharynx. It connects to the back of the mouth, which is the oral pharynx. Next, the epiglottis is in the open position, so that's going to be next. So when it's open, it's in the up position, and that blocks the entrance to the laryngeal pharynx. Right? So it needs to be in the open position. Next, we're going to go down the windpipe, trachea. The windpipe branches, those are called the bronchi. And when the branches get smaller and smaller, those are called the bronchioles. The blind-ended sacs in the lungs are called the alveoli. And for gas exchange, wrap around the alveoli, you have the capillaries. So that's the tracing from the nostril all the way to the bloodstream. All right, 2 more tracings to go. Sperm to the outside world, and then the egg to the outside world. So we'll start with the site of spermatogenesis. That is in the seminiferous tubules in the testes. The sperm is then stored and matured in the epididymis. The tubing that allows for sperm to travel to the outside world, that tube is called the ductus deferens. aka vas deferens. Then we go through the opening in the abdominal cavity called the inguinal canal. The vas deferens then wraps around the bladder, connects with the seminal vesicle, produce about 60% of the ejaculate. The next gland is the prostate gland, that produce about 30% of the ejaculate. Next, we'll contact with the bulbourethra gland, secretes that milky, mucus-like pre-ejaculate. Next, the head of the penis, called the glans, and then the covering of the glans is the foreskin, aka the pubis. So that's sperm from production to the outside world. And the last question for this assignment is egg to the outside world. So starting with the site of oogenesis. So eggs are matured on the ovary. It is caught by the ends of the tube, and the ends of the tube are called the fibrin ends, the infundibulum. The tube is the uterine tube, where fertilization should take place. Then the top part, the dome part of the uterus, is called the fundus. The main part of the uterus is the body of the uterus. The neck, or the opening to the uterus, is the cervix. Next, we have the canal leading to the uterus, which is the vagina. Then we have the inner labia minora, and then the labia majora, the outer lips. All right, so double check your responses before you submit week 2, day 1 assignment.